So what is acceptance and commitment therapy, or ACT therapy? So this is a type of psychotherapy which is used, and it was established in 1999, a bit newer than cognitive behavioural therapy. And instead of CBT, which is about kind of managing your struggles and anxieties and then learning to kind of move on from that, this is about accepting your struggles and anxieties and learning to live with them. And it covers all these various concepts. So I'll just go through it very quickly. So the top one is cognitive diffusion. So basically learning to not make images or feelings concrete, so to let them recognize that they're just feelings. Acceptance is the sort of the key thing about it. So allowing unwanted private experiences to come and go without struggling, so accepting that they're there. Contact with the present moment, which is another way of saying mindfulness, awareness of the here and now. The self as context, which I was trying to get my head around because it's obviously a kind of more psychological concept, but acknowledging how events are experienced by you, which is different from the event itself or what might theoretically happen or how others perceive things. Values, what's important to you. And then lastly, though this isn't in any particular order actually, but lastly is goal setting and carrying them out with integrity, which is true to one's deepest wishes and longing, which sounds very deep, but actually when you think about the use of this particular therapy, which I'll come to, it does make sense. And it's delivered through psychology sessions or self-help tools, and it's in the NICE guidelines for chronic pain, so it is established. So how does this play about in practice in neurological diseases? So it's been trialled and used and proposed as RCTs for a variety of neurological diseases. So firstly, just an example is functional neurological disorders, where there's a series of patients in Leeds where they went through this process of ACT therapy, and there was improvement in FND symptom interference in their daily life in 5 out of 8 of the patients, and 2 patients had evidence of clinical recovery of their symptoms. But more recently, so in 2022, there's a trial in 2018 which was started in muscle disease, which was an RCT, looking at the intervention of ACT therapy versus standard medical care, and the results aren't available for that yet. And then in particular, there's an ongoing trial which is finished recruitment but not yet published in motor neuron disease. And obviously it's of particular interest to me. And essentially, with motor neuron disease, it's a very fast progressive disease, so sometimes there's not time for something like CBT to work, and also it's sometimes not that effective because the patients are accumulating disability. So ACT therapy has thought to be more feasible. And this is this trial which was started last year. It's the largest trial of psychological treatment for MND, a multi-centre RCT over 4 months, so quite a contracted period of time. And there is an assessment of clinical and cost effectiveness. So the results aren't published, but it has finished recruitment. And it's thought that perhaps if people can accept their condition, accept there's a disability in this kind of psychological framework, then they might be more open to early intervention with feeding tubes almost prophylactically, and anticipated care planning so that there's not a kind of crisis point later down the line. So how can we incorporate ACT into our daily practice? One of the concepts that I came across in the psychiatry clinic was, which I thought was a really nice way of framing it, is that you can use it as a sort of approach for palliative neurology or palliative psychiatry, palliative taken in the very kind of global, holistic way, where you're trying to introduce the concept to patients that they are going to have these feelings of anxiety and struggles associated with their perhaps terminal or life-limiting disease, or a permanently disease with permanent disability, and to go through the process of accepting that and living with it. But also it can be used for people with functional neurological disorders, just in the way you kind of phrase things, and also in patients who have symptoms impacted by psychosocial health, so perhaps difficult social circumstances at home or addictions or things like that. Just a couple of phrases that I've picked up from doing my reading. So acknowledging that people have difficult feelings and thoughts, which is normal and part of being human. Trying to focus on the here and now rather than extrapolating on what might happen in the future. Asking patients what aspects of their life are most important to them and focusing on them and how you might help them achieve the best quality of life within those particular aspects. Not necessarily applicable for people with maybe terminal diseases, but just sort of saying when you feel most alive, what are you doing or not doing? So what brings you joy? And can we help you set some goals? See that there. So yes, just some things that we can maybe incorporate into our practice for people with these particular conditions.